This is the herpes virus, one of the 80 kinds which have been identified so far. Out of these, 8 are known to be human pathogens, and they include the common varicella zoster virus and the herpes simplex virus, or HSV 1 and 2. Viruses complicate life. The lifetime risk of getting herpes zoster is 10 to 20%. In a survey in India, 16% of married couples were estimated to be infected with HSV2. At GSK, we understood the impact of viral diseases on human life way back in the late 1960s, when we initiated our research into antivirals, focusing on herpes viruses. GSK is the pioneer in antiviral therapy. From the labs of Wellcome Foundation emerged Nobel Prize-winning scientists such as George Hitchings and Gertrude Alien, who developed the world's first antiviral drug, acyclovir, available worldwide as Zovirax. Zovirax became the mainstay of treatment against herpes virus infections for a long time. However, as a research company, we continued our foray into developing still newer antivirals with simpler dosing, which would improve patient compliance and would target even the less sensitive viruses. In the mid-1990s, GSK introduced the next generation antiviral, valacyclovir, an oral prodrug, the L-velyl ester of acyclovir, that achieves a high bioavailability, 3 to 5 times that of oral acyclovir. Valacyclovir, Zimivir, has similar efficacy and safety profile to that of acyclovir, but with a simple dosing that may enhance patient compliance. When herpes complicates life, make life easier with Zimivir. Higher doses of oral valacyclovir reaches plasma concentrations equivalent to IV acyclovir and a bioavailability 3 to 5 times that of acyclovir. Acyclovir has poor water and lipid solubility. Therefore, the absorption in the small intestine is by passive diffusion, which is variable and incomplete. Thus, due to its limited absorption in GIT, acyclovir has low oral bioavailability. The absorption of valacyclovir in the small intestine is by active transport. It is transported across the intestinal epithelium via a carrier-mediated mechanism involving multiple transporters. Thus, valacyclovir has a 3 to 5 times higher oral bioavailability than acyclovir. Because of its high bioavailability, Zimivir can be given to the patient in a more convenient dosage of 1 gram 3 times in a day for 7 days in herpes zoster, with similar efficacy and safety as acyclovir. Pain, acute pain, or post-herpetic neuralgia is the most debilitating feature of herpes zoster. Valacyclovir significantly reduced zoster-associated pain 34% faster than acyclovir. With valacyclovir, fewer patients had post-herpetic neuralgia at 6 months as compared to acyclovir. Patients with genital herpes, besides experiencing the pain and discomfort it brings, also feel depressed, isolated, and anxious about recurrences. Valacyclovir 500 milligrams can be given in a simple-to-follow once-daily treatment for suppression and twice daily for episodic treatment. In a clinical study in genital herpes, valacyclovir 500 milligram once daily for a year resulted in 0 recurrences in 67% patients. 80% of patients experience 0 or 1 recurrence throughout the year. Patients with genital herpes are concerned about transmitting the HSV2 infection to their partner. Studies show that 70% of transmission to partner happens during periods of asymptomatic shedding. Valacyclovir is the only once-daily therapy proven to reduce risk of transmission of genital herpes. There was a 75% reduction in risk of transmission of symptomatic genital herpes versus placebo with Valacyclovir 500 mg once daily treatment. Zimivir makes life easier in herpes zoster. Zimivir makes life easier in genital herpes.